Well, good morning. We're here today on Treaty 6 territory, and I recognize the Métis people of Alberta who share a deep connection with this land. I'm very pleased to be joined this morning by Dr. Rick Spooner, who is a family physician and a former chair of family medicine at the University of Alberta, and he is here today to speak about our policy proposal about family health teams and modernizing primary care. You know, I was proud to join Alberta NDP leader Rachel Notley last week in Calgary to launch our family health teams plan, a plan to rebuild and strengthen primary care, which is critical in addressing the current health crisis. Too many Albertans can only access the health system at the moment by going to an emergency room or calling an ambulance. And I've spoken often about the challenges that Albertans are facing now in accessing both. That's why we need to provide access to primary care for the hundreds of thousands of Albertans who do not have a family doctor or primary care provider. Our plan is based on what is needed now and is designed to build for the future as well. Prospective medical students want more team-based care in family medicine, similar to the interprofessional work that takes place in hospitals. Changes in investment in primary care must support a model that new health care workers want to participate in. Our plan is built on continued consultation and implementation with healthcare workers, communities, and experts. If elected, we're committed to working with doctors and healthcare workers to reform primary care. We will not take the UCP's path of working against them. I'm glad that we've gotten so much feedback already about our plan. I've heard from many at my office through social media. We're going to be hosting public consultations so that we can get more feedback on March 1st and 9th to hear directly from Albertans on what they think about our plan and the future of healthcare in our province. We reached out broadly to many doctors and healthcare workers for input about our plan for primary care, and Dr. Spooner said he liked what he read, so we asked him if he'd join us to talk about it. Dr. Spooner has extensive family practice experience and teaching experience in family medicine. He knows primary care, and he knows what is needed for the future success of healthcare. So to speak more about that, I'd like to welcome Dr. Spooner.
Thank you, Mr. Shepherd. I'll start by sharing just some of my background. I graduated from the College of Medicine at the University of Saskatchewan in 1974 and began practice as a family doctor in 1976. I spent the first 11 years of my practice in rural practice in a small town in southeastern Saskatchewan. And in 1987, I made a change and joined the Department of Family Medicine at the University of Saskatchewan. In 1991, I was attracted by the Rural Physician Action Plan and moved to Edmonton to join the Department of Family Medicine here at the University of Alberta to help them set up a rural training scheme. In 2000, I became chair of the department and was chair until 2013. I've had a lifelong involvement with the College of Family Physicians of Canada and was privileged to serve as its president in 1994. I've also been involved with the Edmonton Southside Primary Care Network since its inception in 2005. I no longer work in family medicine or practice family medicine, but I continue to work as a hospitalist. Despite living in Edmonton for 31 years, I remain a die-hard Rough Rider supporter. I was asked if I would give my impressions of the proposal that the NDP has produced. The proposal to establish freestanding clinics staffed by physicians with co-located supporting teams is very much in line with current thinking regarding primary care delivery in Canada. The authors of the proposal have done their homework. Their document, in my view, is written with academic rigor. Its data and conclusions are based on the Alberta and the Canadian literature. The proposal sets out a coherent legislative and implementation pathway to achieve its goals. Of all the documents on this subject that I have read, and that's been quite a few, this one most palpably gets to the heart of the matter and offers practical solutions and obtainable solutions. The creation of primary care networks in 2005 was the first step in primary care reform in Alberta. This proposal represents the next stage in this evolutionary process. It's not like we're starting from scratch. So let me just offer some home truths. First, there's clear evidence going back to the mid-1990s that a robust primary care component is the single best guarantee of an effective health system. This has been shown time and again in Western Europe. And if you look at the OECD rankings of the best health systems, they all are characterized by a very strong primary care movement. Second, physician-centric general practice is fast disappearing due to the exigencies of modern medicine, societal change, and population demographics. Third, experience elsewhere, especially in some of the not-for-profit providers in the United States, like Kaiser Permanente or Intermountain Health, have shown that team-based practice successfully delivers safe, effective, and efficient care to large populations. Fourth, our system of primary care in Alberta is becoming less and less attractive to medical students and young physicians. Mr. Shepherd referred to this a few minutes ago. Our graduates just want to practice medicine. They don't want to be small business entrepreneurs. That's not in their plans. So what do we have to do? And by we, I mean our society, our government, our doctors, our politicians. What do we have to do to make this proposal a reality? We have to fund this endeavor. Someone has to pay for the team personnel and the real estate they occupy. In Canada, that means the provinces, not some not-for-profit corporations, charities, or insurance companies. There has to be a culture shift in our population at large, in the medical community, and certainly in the province's health bureaucracy. New training schemes will have to be geared specifically to primary care in nursing, pharmacy, and behavioral health, just to name three. We will need change management support, and believe me, we'll need lots of it. I don't have much more to say on this matter right now. I just want to say, if you need a good reference, I recommend an opinion piece published in the Edmonton Journal last February 11th of this year, titled 6 Ways to Improve Primary Care by Donald Philippon and colleagues. Have a look at that. It summarizes exactly the way we need to go and what we can do about it. So thank you for this opportunity to speak to you this morning.
Excellent. Well, thank you so much, Dr. Spooner, for your endorsement and your support. We're happy to take any questions.
Thank you. Just a reminder, if you're on Zoom, it's the raise hand function, or if you're on the phone, it's *9 to get into the question queue. Oh, we'll go here. Lisa Johnson from the Edmonton Journal.
Hi, Thanks for taking my question. I'm wondering, Dr. Spooner, if since you're weighing in on this, the NDP's plan for primary care health teams, if you might have had the opportunity to read the two interim reports recently released by the UCP that look at their primary care, that look a lot of these primary care issues. And I'm wondering if you have an opinion on some of the recommendations in those interim panel reports.
I'm sorry, which report was that? I can't quite hear you clearly.
There was two panel reports released this week from the UCP. One was the strategic panel on primary health care, and the other was on Indigenous primary health care.
I know the reports you mean, but I have not read them.
Oh, okay, thank you.
Do you have a follow-up, Lisa?
No, thanks, that's good.
Okay, we'll do one more pass for questions. If you're on Zoom, it's raise hand. If you're on the phone, it's star 9. Seeing none, that concludes our press conference for today. Thank you.
For watching, and to learn more, check out albertasfuture.ca.